Good morning, guys. So I just wanted to kind of pop on here, go through what all of this is. So these activity statements, I want to get you guys familiarized with what your NCLEX test plan is going to look like. So hopefully you guys have all been kind of studying, getting ready for our exam on Monday. So with these activity statements, so these are going to help to further guide your studying. So again, you should have that baseline knowledge prior to going through these. But I'm going to break down a few of these just to help you guys kind of get in the flow of applying what you understand. So that's what these are designed to do. So when we go up here to this first one, those system-specific assessments and the potential for complications from abdominal procedures. So when we think of abdominal procedures, our priority goal is making sure that that GI tract wakes back up, that we're looking for signs and symptoms of infection. So when we go into how would we assess a patient or what could we ask a patient post-abdominal procedures? We're going to think of our bowel assessment. So what bowel sounds would we expect to hear, or when would we want that peristalsis to restart? So also other questions when we're thinking of like peristalsis, we're looking at flatus, stool. So have they had that bowel movement? When we think of like post-EGD, so what is an EGD? That's where they're going to put some type of anesthetic or do some type of like conscious sedation for patients to drop that endoscopy tube. So what is our priority with that is we want to make sure that that gag reflex has woke back up. When we think of ERCP, so what is an ERCP? That is going to be a surgery or a procedure for a patient. And so what do we know about procedures? Procedures are we're going to have that consent signed. For ERCP specifically, they do some like endoscopy stuff. And so they may do like some type of spray anesthetic to numb that, to help with some of that gagging that may be associated. Also, what are the specifics on an ERCP? So this procedure lasts about an hour. If you listen back to that lecture, we talk about how this patient has to lie still for 1 hour. So they can't move around. So educating the patient on that, that helps to prevent those accidents or errors that can develop from this procedure. Rolling on down, so oral health care screening. So what are some of those findings that we may see as far as like disease detection? So again, in that lecture, we talk about erythroplakia and leukoplakia, that recognizing those are early signs of oral cancer. Priorities, nursing diagnosis for oral cancers. We think of, what are our nursing diagnoses, our major concerns with oral cancers or tumors. Remember, they affect the upper airway. So we're looking at like ineffective airway clearance, airway issues, anything of that nature. Those are going to be our, again, priorities. Pathophysiology of that sliding hernia. So what is the pathophysiology of it? So where does this happen? What causes these to develop? We can roll on down here through like post-op gastric cancer patient. And so what do we know about post-op gastric patients? That we will slowly advance their diets. We're looking again for infections that can arise post-op, things of that. But then it goes on further and talks about dumping syndrome. What do we know about dumping syndrome? And how would we help to prevent a potential complication such as dumping syndrome in patients that are post-op? So that would be limiting their fluids with meals like we had talked about. We can kind of roll over here to like lab values. When we talk about lab values in colorectal cancer, we're looking at those white cells, those neutrophils. We're looking at the hemoglobin hematocrit to see if they have any blood loss associated with this colorectal cancer, but also those specific cancer markers such as that CEA marker. And we would want to know like what those limits are when we're looking at alterations in those lab values. We can go back here even more and we're looking at that hemodynamics associated with cirrhosis. So when we're thinking of cirrhosis, what affects their hemodynamics? So what is specific? So these patients have those big fluid volume shifts. So how do we manage those fluid volume? Again, that patient gets that abdominal distension, that ascites. So how do we manage that? So looking at how do we manage this different disease process. That's how we are not just knowing the information, but then we're taking it a step further and we're able to apply it to these nursing concepts here. So I hope that this makes sense to you. I hope that that was helpful as we kind of roll down through here. If you have any questions regarding specifics on this, please just reach out. Let me know. I will help to, will try to get back to you guys as soon as I can with that. But otherwise, I hope that you guys have a great Valentine's Day. Be safe and let me know if I can do anything to help y'all.